Hi everyone, I'm Paige Abbott and this is your weekly recovery message. This week I thought I would talk about anxiety. Anxiety is something that a lot of people experience. Often it's in anticipation of an event, maybe a public speaking event, an important meeting, an important test, an upcoming change like a move or a wedding or a divorce, things like that. Essentially, anxiety is the sensation that we get of maybe physical symptoms like heart racing, tightness in the chest, shortness of breath, shakiness, heart palpitations, difficulty breathing, almost sometimes feeling like people are having a heart attack, even though there's no actual issues with their heart functioning. But it can also come with a lot of racing thoughts, and anxiety is directly correlated to fear. So we feel anxiety when we're scared. And as I was just saying, sometimes this fear is real. So anticipation of things that are going to happen. Of course, our brains may anticipate the worst in these events happening, and they may actually go quite well and be lovely things for us to experience. But also, anxiety can be based on totally unrealistic fears that really have a very little chance of coming true, and yet our brain continues to script and create these stories that our rest of our physiology sort of hooks into and creates this fear response. Now, anxiety can be a standalone mental health condition, but it does go very commonly hand in hand with addiction. So people who know that they have addiction, it is very common that they will experience anxiety and or symptoms of depression as well. That does not mean that they have this entirely separate mental health condition. Anxiety, if you think about it, is a pretty natural bedfellow of addiction because it latches onto those stories. And the disease of addiction, as many of you know, loves to generate stories. So the woulda, coulda, shouldas, and looking into the future for the absolute worst case scenarios that are going to happen. And of course, that comes with a feeling of fear and anxiety. If you are somebody who's vulnerable to experiencing anxiety, if you know that you have addiction, I certainly would recommend using your recovery tools. So things like journaling, turning to your support system to talk through what you're feeling, and just to get it out can be helpful as a way to recognize, yeah, actually, I am safe and I am okay. You don't necessarily need any solutions or feedback or fixing from the other person's end. They just need to listen, and you just need a place to vent those fears and those thoughts to help diminish that anxiety that you're experiencing. These tools certainly help even if you don't recognize having addiction. The use of mood-altering substances, so drugs, alcohol, nicotine, sugar, and other behaviors like shopping, food, gambling, to cover up or soothe feelings of anxiety would not be recommended for anybody, whether you have addiction or not, as all you're doing with this is covering up the underlying feelings that are there. So the best thing you can actually do when you have a feeling of anxiety is ride the wave. So kind of go into the wave rather than keep trying to backtrack and fight it and push it away and rationalize yourself out of it. Just go into the feeling and look after yourself. So slowing down tools, particularly things like meditation, relaxation, and mindfulness practices are particularly helpful for those symptoms of anxiety because they really allow you to sit with yourself and kind of decompress as you go within. So the more you can practice letting the feelings come, acknowledging them and processing them, using those tools like journaling or talking, and as well learning to sit with yourself and slow down using those techniques like meditation, mindfulness, and journaling, and relaxation do tend to be the most helpful ways of coping with anxiety. And the bottom line is also not to panic, meaning when you have anxiety, you will want to panic and the anxiety will keep building. But it's important to recognize that anxiety, just like every other feeling state that we possess, will start but it will also end. So all feelings will come and go. It won't be like that forever. And even if you're in a moment of intense anxiety, it's important to just remember that this too shall pass. I wish you the best in your ongoing journey of recovery for the week, and I will talk to you next week. Bye for now.